Diapering in a home setting is different than diapering in a center. For one, basically, is in a center, you have a place that's already designated for diapering, it's already set up. But in a home, that's different. Many times in homes, you might think, obviously, that diapering in a bathroom is the best place to be because you're close to a water source, and most times that's what you would think of as being in a bathroom when you're going to be doing some diaper changing. However, when you're by yourself in a family childcare home, you need to be watching the children. So your bathroom might be a place that's very far away from where the children are. So what I think would be a great idea is to bring the diapering to where the children are. So that way you can still be supervising the children, but you can also be changing the diapers. Things that you're going to need for diapering, obviously first would be your changing pad. So bring in a changing pad with you. I like this one because it has a handle. It's portable. It does not have any straps with it. So it's something that you can bring with you when you're changing the diaper. So that will be your changing surface. The other thing that I found that works really handy is to get a caddy. You can get these at any home store. You can also get them at Walmart, Target. It's just a way that you can keep carrying or bring all your supplies with you, so it makes it a little bit easier that you can carry them. So obviously things that I'm going to need are wipes. Wipes being for disinfecting the pad. That tends to work better when you're doing changes in front of children or around children and you're on the floor. Just because if you do use the spray bottles, you will have to spray the pad and let them have contact time or let it have contact time. So then that would be a time where children could get onto the pad and get into that chemical. So I found that when you're doing diaper changes, like I said, with children present and you're on the floor, it might work better just so that you're using a disinfecting wipe. And you can use any disinfecting wipe as long as you use the ones that are EPA registered and you're using them according to manufacturer's instructions. So that's what I'm going to use for disinfecting the pad. Obviously I'm going to need to use my wipes so that I have wipes available and bring those with me. I also have garbage bags because you are diapering on the floor and you maybe will be in a playroom or you might be in the living room or somewhere that you would not readily have a foot operated garbage accessible, which is what is recommended to have. Then what you could do is just use a garbage bag such as this or plastic bags such as this. Just make sure there aren't any holes in it because these tend to get holes pretty easily, and obviously that would be something you wouldn't want to have happen. But just make sure there aren't any holes, and this would serve as your garbage for your soiled diaper, your soiled wipes, anything that you're going to be using, and your gloves for diapering. So that I would have it available. It's also nice to have another bag available, at least one, just in case you do have soiled clothing, because then you would have a place that you could put the soiled clothes in to and tie off if that was something you also had. Then of course you'll need your clean diaper. Have your clean pair of gloves if that's something that you do wear for diapering. You can have a product that you need for their diaper ointment if that is something that they need, that you have that with you. And then I have some Kleenexes as well, so that could be used as your barrier to put the diaper ointment cream on for applying that to the infant's bottom. And like I said, this all fits in your caddy so that you can take this with you when you're moving from place to place. Now you want to be preparing yourself to get ready to diaper, so having everything with you. So obviously, like I talked before about supervision, it's good to position yourself somewhere where you're able to still visualize the children or the majority of the time while you are still able to change the infant's diaper. So having that changing pad placed on the floor, like I said, is what we need to do first. You want to get your wipes out ahead of time. I know that I'm going to need 3 at least each time with each diaper change. And then I also leave the cover open because you don't know how many you might need if the diaper is soiled, and that is something that you might need more than that. Then you want to make sure that you place these out so that I can get them. And then to have my clean diaper available. And then if I know my infant needs diaper cream or diaper ointment placed on their bottom, then you can at this time get that out and put that on the tissue and have that all ready to go. I know that obviously for sure I need one open for my garbage. And this one I would make sure that whenever you have the garbage that's closest by you, and just kind of in a place that you might find is less likely for any infant or another child to get into while you are trying to diaper, because you kind of want to keep that close to you so you don't have that way over here somewhere that a child might get into, just so that you keep that close by you so you're closely monitoring that, and just have your all of your supplies readily accessible. Gloves are recommended but not required, but I like to always wear them myself just so that it's an extra barrier whenever I'm diapering so poop can't get underneath my fingernails or in my ring. So I have my gloves on, and then I would go over to the child. And this is always a good thing to remember too before you change diapers, to always tell the child what you're doing so that they know, and you're not just grabbing them abruptly and placing them on the pad, but to always be respectful in your care and your approach of the child. To be, hi honey, we're going to change your diaper. So I'm going to bring you over here. We're going to get dry pants. How does that feel, huh? And then place them on the pad. And like I said, I'm positioning myself so I'm able to see what's going on in my living room or in my playroom while I'm changing the diaper, but yet I'm still able to take care of the child here at hand and try to change their diaper. And like I had mentioned before, that if the clothing is soiled, what we'd like you to do is just directly bag it and to send it home to have that laundered by the parent. And next obviously would be to be removing the diaper. And I don't know a nicer way to say it, but just to use the diaper to get as much of the poop off the bottom as I can, or to use that, so I need to use less wipes. So to use that diaper to remove it is just fine. And then you just want to fold that under so that that's a surface underneath the infant's bottom. And then you would want to take a wipe, and you always want to make sure, even if it's just wet, that you're wiping the child's skin, or stool is always obviously would be the poop that you'd want to make sure that you're removing. But even when it's just wet with urine, it's good to remove that as well. So you just want to make sure that you wipe the bottom clean. And you'll know if you need another wipe. There's nothing wrong with folding it, just to make sure that you have a clean surface each time that you're wiping the skin. And then you can take that, and then you would want to put that in my garbage here. Okay, this is where I take my gloves off. And you always want to make sure that you're grabbing glove to glove, and that you're not touching your bare skin with a gloved hand. So that's something that you can either grab at the ends of your fingers, you can grab here in the center of my palm, or I can grab at the wrist, whatever is a good place for you to grab. And then you just remove that glove, and then you can ball it up in your gloved hand. And then since you took your glove off, you can take your bare hand and you can slide this underneath the wrist part and pull it off, which turns it inside out. And then you have your glove off. So then I can dispose of that in the garbage. And then the second wipe that I have available here is for my hands. And you always want to do your hands before you touch anything else, just because you want to make sure that you have, if you got anything on your hands, be it poop or any other germs, that you're trying to get that off with the wipe. So that's why you always do your hands first. If I was not wearing gloves, the same thing would happen. Once I'd wipe the child's bottom, got rid of the diaper, that's still when I would wipe my hands with the wipe. And then you want to take the third wipe and do the child's hands. Hi, sweetie, we're going to wipe your hands off. And the reason being is just because typically when you do have the child's diaper off, they are probably going to be exploring their diaper region. And they might get obviously germs on their hands, or maybe they got their hands into something when you were trying to wipe them. And so you just want to make sure that that is something that's removed off their hands. So after you have all of the wipes used, then this is where I would go and get my clean diaper. And I'd slide this under the child. Hi, sweetie. And if I did have diaper ointment that I need to apply, this is when you would apply it. So like I had said earlier, if it was on, I should have that ready on a Kleenex or some other barrier. You can use a clean wipe too as another option to try to apply it. Some people put it directly on the diaper and then apply it with the diaper. It's just important not to put it on your bare hands, because it's really hard for your person to wash that off. And then what I just need to do is to put the diaper on. Okay, sweetie, I'll get you all dressed. It's important when you're redressing your child or the child just to make sure that they are remaining on the pad, either lying down, or you can also take them off the pad and get them dressed, or you can lie them down on the floor next to the pad and get them redressed. The biggest thing is not to have the child stand directly on the pad. They have done studies where actually the germs from the diaper pad themselves, which be poop or pee, get actually on the children's feet, on the child's feet, and then obviously they'll be walking around your home and they'll track those germs on all your floors. So you just want to make sure that they are not standing directly on the pad. Okay, so I finished changing my infant's diaper, and now would be the time that we go wash hands normally. However, in the way that we're diapering here, I do not want to leave all of this accessible to all of the children. My dirty soiled pad, my garbage, my supplies. So unfortunately, I'm going to have to take care of this first and then take these with me, and then we'll be doing our hand washing. But because the infant here, I do not want the infant to contaminate any other surfaces. I'm going to need to hang on to the infant. So I'm going to have the infant in one hand here, and then I'm going to have my other hand to be doing all my other work. So, because you want to make sure that you definitely are keeping that infant from touching the other surfaces. So then I would get my disinfecting wipes here, but I'm going to need 2 of these. So I'm going to need one that I'm going to be using for my washing step, and then one I'm going to be using for my disinfecting step. So it would be to take one, and you want to make sure that you get everything, all the surfaces wiped down completely. And then I would dispose of this in the garbage, and then this would be my second wipe. And then you want to make sure that you wipe the entire surface. And once again, then put that in the garbage, and then I could put my wipes back in my caddy. And I could take my wipes here and place that in my caddy. And then I'd want to tie off the garbage. And this would be also just a reminder that this should be placed in a covered garbage that is inaccessible to children. So that's where the soiled diaper and the soiled diaper supplies would go. And then I would grab my pad and my caddy. And this makes it kind of hard in the way that I know you have lots to carry, but to make sure that you have all your supplies. And then I could go to my bathroom, the nearest water source, to be able to wash hands for me and my little sweetheart here. Now that I'm done diapering, it's time to wash hands. One thing to always remember is always supervision, because we talked about that earlier when you're caring for other children and it's just you alone. It's just really important, if you can, to pick a bathroom that's close by the other children if possible. So I would also, if you can't visually see them, then at least leave your door ajar here so that you can at least hear them. So you can always be within hearing, because with licensing, you need to be within hearing or vision at all times. So as you can tell in the bathroom that I have here, I have the supplies that I need. I've got my paper towels, I have my soap, obviously a sink, and a step stool is always handy. For one, it keeps the child more secure. Another thing that also helps is on your back, just because when you're expecting you to wash their hands so frequently, and each child weighs a different amount, and might be hard for you to feel like you can hold them up to the sink safely without hurting your back. Water in your home should be 120 degrees, and that is what's required for licensing. However, sometimes it is hard to monitor that and to keep it maintained at that. So I would always hope that you would check the water temperature before you stick the infant's hands in the water stream to prevent the burn from occurring. Another thing that I found is helpful is to get a faucet extender. If you're finding it gets hard to bend over and get close enough to the sink, you can find those online, and that helps bring the water closer to the infant. So I would get my infant's hands wet, get some soap, and you want to shoot for 10 seconds per hand, because 20 seconds total for hand washing. But if you wash each hand, so 10 seconds, and rinse off all the soap really well. And then you leave the water running. Get a paper towel and dry their hands really well so that you make sure that they don't get chapped or red, and obviously to make sure you have all the soap off too, just so that's something they don't rub in their eyes or put in their mouth. And then with your paper towel, that's your barrier, and you use that to touch the faucet to shut it off so you don't have to get any germs back on your hands. And then you just take the paper towel and you dispose of it in the garbage here. After I've washed the infant's hands, I need to make sure that they're in a safe place. So this might be different in any home or environment that you have. So things to think about is where it's close by so I can do this as quickly as possible. You might find in your bathroom, if you just have a small infant, that it would work to just lay the child on a soft rug on the floor. Obviously, I wouldn't want them on hard tile, but if you have a soft rug, or you could place them there just while you're washing hands, because then I could be washing my hands, have the infant nearby, doors ajar, and I'm able to still hear or see the children out here. The other thing you could do is you could also bring a bouncy chair in here, or something that you set the child in just after you wash their hands. So then therefore, once again, close by, safe place, but I'm still able to wash my hands, see the child, and supervise the other children as well. After I've washed the infant's hands and put he or she in a safe place, then it's my turn to wash my hands. So same things apply as I did with the infant. I have all the supplies. I got my paper towels, I got my soap, obviously my sink. Get the water started. Get soap. And it's important to shoot for 20 seconds. And this means actually making suds for 20 seconds. So as you can tell, I'm covering all surfaces of my hands, the palms, the top, in between. If you've got rings or jewelry, do not take them off. Leave them on and wash well around them so you're not putting a dirty ring on clean hands. The other thing to think about is your fingernails. Those can also capture germs, so you just want to make sure that you're washing each fingernail as well, especially if you have long fingernails, to make sure that you're cleaning that well. Your wrists as well. If I had a watch on, you can push that up ahead of time. So after I've washed for 20 seconds, then I would let the water rinse off the suds, making sure that I get all the soap off. Leave the water running. Get paper towels. Dry my hands well so that I get all the water off so they don't get sore or chapped. And after I have them dried, have this paper towel as my barrier to use to shut off the faucet, and then dispose of that. So now my hands are clean, baby's hands are clean, and now I can return back to my other children that I take care of.